Well, good evening and welcome, ladies and gentlemen, to this third webinar in our series of 4 on how to improve the radiation experience for patients and families. And of course, it's hosted by SAHMRI, the South Australian Health and Medical Research Institute in Adelaide, and the Australian Bragg Centre for Proton Therapy and Research, which is being built even as we speak. My name's Julie McCrossin, and I was treated for stage 4 oropharyngeal throat cancer with radiation and chemotherapy back in 2013, and very pleased to be 8 years later and here with you. Our focus tonight is all about children, adolescents and young people, and we're going to take you to Westmead Hospital west of Sydney, to the MacCallum Cancer Centre in Melbourne, and also to the Adelaide Women and Children's Hospital in Adelaide. And we're going to share with you great examples of assisting young patients and families to have the best possible experience during cancer treatment, especially with radiation therapy. I'd like to begin by acknowledging that I'm on Aboriginal land. We're broadcasting to you tonight from the land of the Gadigal people. I'm in eastern Sydney. And I also want to thank the partners for this evening's webinar, ANZCHOG, the Australian and New Zealand Children's Haematology Oncology Group. This is a peak professional body for paediatric oncologists, so oncologists working with children, but also all health professionals caring for children with cancer. And they're also very involved with a national cooperative clinical trials group to get the best possible treatments developed and to young people as quickly as possible. So we'll meet Dr. Ben Saxon from Adelaide Women and Children's Hospital, a member of ANZCHOG, a little bit later. And our other partner tonight is Cancer Voices South Australia, and welcome now to Vicky Bedford, who's the Chair of Cancer Voices. Good evening, Vicky, great to see you.
Hi, Julie.
G'day. And Vicky is going to highlight 2 or 3 aspects of each of the cancer team's work that we see during this webinar, highlight 2 or 3 elements that she thinks it'd be great to see elsewhere. And Vicky is a member of the Consumer Advisory Group for the new Women and Children's Hospital in Adelaide. It's being built in Adelaide, and 2 other committees with the current hospital, as well as being the chair of Cancer Voices SA. But I mean, Vicky, the most important thing is you're the mother of a young person who's been treated for cancer. We heard your story in one of our webinars last year, but for people joining us for the first time tonight, just a little bit about what your daughter was treated for and how she's going.
Hi, Julie. Yeah, as you said, my daughter was treated when she was 2 years old. She had a rare cancer called Ewing sarcoma on her spine, and she was treated multimodal. So that means she had the surgery to remove as much of the tumor as possible, as well as chemotherapy, and then radiation, which she was able to get the proton therapy radiation, which I'm not sure if you know, but as we've said in one of our previous webinars, Adelaide's about to get the first treatment center here in South Australia and in all of Australia for proton therapy radiation.
Vicky, you and your daughter, you were at the MD Anderson Centre in the United States at that time.
Correct. She's now 14 and a half years old, 12 years off of treatment, and doing really well.
Fantastic. Well, look, just before we begin, just tell us 2 or 3 things that Cancer Voices SA does, because I know there are Cancer Voices all over Australia, but 2 or 3 things you're doing there in South Australia.
Well, we're a 100% volunteer organisation, and we're led by passionate people, and we just try to help raise a voice and advocate for people being affected by cancer, both people who are being treated as well as their families and carers. One of the most important ones that we do right now is we do a program called Survivors as Teachers, where we train third-year medical students, and we share our stories to help them understand the human side of things in a more holistic way of treating people.
I'm really going to look forward to your observations this evening as you see how people are trying to improve their care for patients and families, because obviously you've been on the front line yourself. So I'll welcome you back shortly. But ladies and gentlemen, let's begin. We're going to travel now to Westmead in Western Sydney. Would you just introduce yourselves and tell us a little bit about your son and the condition that brought him here to have cancer treatment?
Yeah, hi, my name is Santosh, and it's my wife Sharine, and our son Devansh, right? So Devansh was diagnosed with stage 4 high-risk neuroblastoma. Interestingly, pretty much on his third birthday. He spent his third birthday in hospital being diagnosed. It was almost a chance finding because he had a sort of a lump on his on top of his collarbone. And after a couple of visits to the GPs, we were referred to Westmead Children's Hospital. And after a series of scans, the diagnosis was made.
And how long ago was that?
So this was about 12 months ago. So we've been about 12 months into treatment now, and we've got a couple of more months to go.
Okay, and do you mind telling me just the sort of treatment your son's been having? Or I should say Spider-Man, because at the moment he is Spider-Man. So what are the treatments he's having?
So he's having what is known as the multimodal treatment. So, it's the work. So we started with chemotherapy, and then we had a resection surgery to get the primary tumor out, whatever was remaining of it. Then we had high-dose chemotherapy with stem cell rescue, also known as bone marrow transplant, followed by radiation. And then we're currently doing immunotherapy, which seems to be one of the newer sort of treatments available.
Look, the purpose of this series of videos is to share good ideas about what makes the experience of particularly radiation treatment better for the young patient and their family. And my understanding is that your son managed to have radiation without a general anaesthetic, even though you're a very young man. So what do you think made it possible for your son to have radiation treatment without a general anaesthetic? What helped you and him that much?
Yeah.
So I feel the support workers, they helped a lot, and the social workers. So support workers in the sense, like when he came in for the radiation, the support workers were there with the toys, and they did a dummy, we did a dummy run as well.
And when you say a dummy run, what do you mean?
Yeah, so
Yeah,
going
Woody.
inside.
Did you have Woody?
Woody, yeah.
Yeah, we got Woody lying on
Woody
the
lying on the bed, and then operating the machine, and he saw that he pressed the buttons to like how to operate it. So yeah, that helped us. I think that helped him more. Yeah.
And did it help you?
It absolutely did.
Yeah, it did.
Yeah. I think we also have been very transparent with Devansh all throughout. We sort of put a bit of effort into sort of prepping him in advance, and sort of coaching him what to expect, just so that he's very comfortable. Look, I must say that there's been really high emotional intelligence within the multidisciplinary team, which has gone a far way of not only helping us but making Devansh feel very comfortable.
Yeah.
And when you say emotional intelligence, tell me what you mean, perhaps some examples.
Just being very, very patient with kids.
Yeah.
We had our the oncologist who took care of us, Dr. Jennifer Chard, who visited us quite often before the treatment, when we were admitted in hospital having chemotherapy. So I feel that she sort of built that bridge, and sort of removed any barriers beforehand. I thought that was very nice, and sort of gave, at least I'd like to think, it gave Devansh a comfort level with her. Yeah. And just being very patient. The whole nursing staff and the radiation technicians, they've been very patient with us, because we had a few runs, and just being open, being very not very formal with us. I thought that really helped. Yeah. It felt like we were with friends, to be honest.
Like a family.
Yeah, and family.
Gee, that's a tribute, isn't it? Hey,
Yeah.
I mean, we're working people, having a culture where people feel like friends. That's not easy, is it?
Yeah.
How do you think they have that culture? What makes it possible?
I think it's definitely coming from the top.
Yeah.
I'm hoping that good culture is sort of inculcated right from the senior management and the culture of the hospital and the institution, and we can see that being reflected in various levels in the system. I thought there was fantastic communication happening internally.
Yeah,
We didn't have to repeat ourselves a lot, so yeah.
Oh yeah, that was fantastic. Yeah.
Devansh, Can you remember having the radiation with the mask on? And
Do you remember? Yeah.
and how did you keep so still?
How was it?
Were you excited?
I have had that treatment too with the mask, and it's not easy to be really still, is it? I'm very impressed with you.
You did a good job.
I seriously am impressed because I have had the mask and it's not an easy experience. I understand that you spoke to your son through the microphone while he was in the room.
Yes.
For people who've never seen a bunker or one of these radiation LINAC machines, explain what you were doing outside to help your son inside and why you could see him in there.
We just spoke to him, like we encouraged him, like we just said like you're doing a good job, and like I think that helped him. That helped him a lot. Like both
so
of
he
us
could
were
hear your voices.
Yeah, both of us. So
We played his favorite cartoons. What was it?
Thomas.
Thomas the Tank Engine.
the theme song.
Thomas definitely helped us.
Yeah.
So a lot of credit goes to Thomas. So we I mean, they have a good system where you can play this sort of music and program it so that it's playing in the background.
Anything else that helped in the actual radiation treatment?
So a support worker was with us.
Yeah.
So,
the play therapist.
Play therapist. So she came in and she was playing with him before he went inside the room, and I think that helped him a lot. Like he felt motivated, like he felt good. Generally.
It strikes me, the numbers of staff are important here, aren't they? It's both their training, but it's their numbers. Why do you say that's right?
Because inside the room there were like a couple of staff inside, and I think that helped Devansh. Like he didn't feel alone, or like he didn't feel isolated in any way. So he knew like there are people around, like there are lots of people around.
So I could definitely notice the staff to patient ratio was quite nice. Because people were aware. We had I must say this very carefully, but we had right amount of attention so that things moved on time, and that's a very important thing.
Explain, why is it important that everything's on time?
Because kids can get very cranky after a certain amount, so every kid potentially has a threshold, right, of waiting and time tolerance. So I thought the time management was very, very efficient, I must say, and that is probably because there were ample resources available.
And I just want to make it clear for people watching this that when you say that Devansh felt he was not alone when he was having his radiation treatment, the reality is he is alone, isn't he? Because no one can be in there near the radiation.
But he can hear the voice, and like he knows like people are outside the room because we explained it to him already. So he knew where we were standing and where we were looking at him, like the computers and stuff. And so I feel he felt good. Just
finally, there'll be some parents watching this who are about to embark on a treatment journey with their child. Any suggestions for them that you think might help them?
I would say just be calm, just have patience, and stay strong.
That's so interesting you say that, because my understanding is your capacity, both of you as parents, to stay calm and steady helped your son. And were you doing that consciously, holding yourselves together?
Yes.
Yeah, absolutely.
We are actually,
The way parents react to the whole situation and everything that's going on has an effect on the kids. So it is very important for parents to stay strong and be very calm, because that is very reflective on what kids pick up and how calm or supportive they are in the whole process. So I would say, look, trust your team. Feel free to be open, ask questions, but be very trusting. You've got a very professional team who look after you. But as parents, you have to do your part to support. It's a two-way street.
It's a relationship.
So it's very important to trust your team because it's a partnership. It's a two-way street, I'd like to think. And it works best when there is, contribution from both sides, from the medical team as well as the patients and the parents. So we have a duty to support as well.
Well, I just want to say on behalf of everyone, we're so grateful to you and Devansh for coming in. Your son is still in treatment, and I know this will really help other families and other children, and I really appreciate it. So thank you so much, and we wish you well for the end of your treatment.
So thank you.
Well, look, I just want to welcome you and thank you so much for being part of this series. And we're focusing on what you do here to improve the experience for your young patients and families. Precision and accuracy is everything, isn't it, in radiation therapy? You've got a whole lot of things with you. Can you tell us, what do you do to help the young patient emotionally, but also to keep still, and if possible, to not have to use sedation, or at least not to have to use a general anaesthetic? What are you doing to help them in that way?
So similar to the adults, a fair bit of equipment's needed depending on the body area that we're treating. So if it's somewhere in the head, region, we're going to have immobilization masks. And as you can imagine, it's probably a little bit daunting for anybody really, but especially children. And so in order to get them to make that mask and wear that mask during treatment without sedation, we employ a few techniques, I guess. We have some sessions before they come for treatment.
What sort of sessions?
Well, we call them play sessions. So we've got a close relationship with the child life therapy department over at the Children's Hospital, and we can set up numerous appointments where they come and they see the department, we can play, we make masks on puppets, we decorate masks, we can play on the machine, show them how that works. I think the more they see and the more they understand what's going to happen, the more comfortable they are when they do come to have their own mask made.
And you've got a Spider-Man mask on your lap. Can you just hold it up and tell us why have you brought that along, and the other mask as well?
So superheroes are pretty popular right now and always. So the more we sort of relate the mask that we do make with something that they can relate to, then the more likely they are to have it made without sedation.
And so what you're holding up there in your right hand, what's that?
So this is our thermoplastic mask that we make. We pop this in a hot water bath. It gets all soft and flexible, and that's what will go over the child's head if we're treating the brain region, and it clips into the bed. So it just keeps them still for treatment and in the same spot every day.
And then why have you got Spider-Man there?
So Spider-Man's just a mask that's a fun mask, I guess. So they can see that. They don't wear this for treatment, but just to relate, sort of, you can wear this one, and this one's not so much different.
So what I'm hearing is that a highly skilled technician like yourself, because you're responsible for delivering the radiation therapy to the patient, that to improve the experience for the young patient and their family, you actually have a lot of time with them, playing and getting to know them and introducing them to the space. Is that correct?
Yeah, that's probably the most important part, just to introduce them to our department, having come from the Children's Hospital where they've got such a support over to us, and just keeping that quality of care high, realising that we're not going to hurt them in any way, that they can come and they can have a little bit of fun with us. Nothing hurts them, no needles, that sort of thing. They get to see the same people every day and build, relationships with the treating staff and the radiation therapists that they do see every day.
So tell us what you've got there, and how does that help when you're working with the child and family?
So this is a booklet that's provided by one of the child life therapists that we work with over at the Children's Hospital. A lot of times before a child gets to us in their treatment, they would have encountered and built up a rapport with one of the child life therapists. So they're showing this before coming to see us, and it just goes through some of the equipment and some of the things that they may need to do over here. So just explaining that they might need to make a beanbag, we call it, just a stabilization equipment that they may need to lay on, that they do it, we can play around, we can do it with puppets, we can do it with toys, and then that they the child's going to do it then after that. So
honestly, Laura, I've got to tell you, as a former patient who had radiation, I don't know why we don't do this with adults as well. Can you show me the beanbag and just explain more what you mean by that? Because you've got one there, And as you're getting it, I'll just explain to people that they have to keep us still, and there's many ways of keeping us still. So what's this one?
So I always refer to this as a bean bag for the children, but it's called a back bag. So it's just full of a lot of little beans. We'll mould this under their head and shoulders. If that's the area we're treating, there's other sort of shaped ones for different parts of the body. And once we've got them in a stable position that's reproducible, we will take the air out of this and it'll just form to their shape and make sure that they lay back in the same position every day when they come for treatment.
Look, thank you so much.
Okay.
My name's Tora Sibbald and I'm a clinical nurse consultant with the Western Sydney Youth Cancer Service.
And what does clinical nurse consultant mean?
So a clinical nurse consultant is a nurse expert in a specific field, and mine is in adolescent and young adult oncology.
You are a navigator and a point of contact. Explain what you mean by that and how it helps the child and family, and give me practical examples.
Often with the young people that we meet, it's their first experience in the adult healthcare system. It's a foreign land, it's a different language that's being spoken, and it's a whole new landscape. So our job is to help navigate that new world. And that looks like organising appointments, helping direct them, and in the end, helping them make their own appointments. So it's a big spectrum to get there, but that's what we're working towards. Often it's interpreting medical information as well. As I said, it's almost like a different language, the medical jargon. So we will sit with the young person and the family in consults with medical staff and help interpret that information in an age and developmentally appropriate way.
What does that mean, age and developmentally appropriate? It rolls off the tongue, but there's a lot of judgment and empathy in action to make that real, isn't there? Explain what it means.
Absolutely. So developmental milestones continue past childhood. So walking and talking in a child are important milestones, and that continues through adolescence and young adulthood. So the brain is not fully developed until about the age of 25. So in those early years, in late teens, early 20s, we're still helping to navigate normal development through the cancer experience.
We've interviewed a young person for this series, and she talked about wanting autonomy and control when she had a very extended period of cancer treatment. And I was thinking, that must be very hard, all different ages, all different cultural backgrounds. How do you what can you actually do to give a patient and the family autonomy and control?
So I think, as I said earlier, being present for those big medical discussions, so that as the nurse consultant, I've got a good understanding of what the options are, what the decisions are, and what the potential decisions this young person might have to make. Then it's important to follow up with the young person on their own to get a good understanding of what they took away from that information. So asking questions, being very curious, reading cues.
What sort of cues?
So that can be physical cues, that could be a word that's dropped in every now and again that triggers a bit of interest, and you might ask for clarification. So I think being curious is a really important part of the process. And then establishing, do they understand for example, if there's a medical decision that needs to be made, do they understand what the options are? Do they understand the implications of those options? So for example, end of life, we're getting towards end of life decision making. Do they continue down the path of experimental treatments or clinical trials, or do they go down the path of palliative care?
Now nothing's more sensitive than what you've just said. At what age would you discuss such an issue with the child as well as the family and the medical team?
I think ideally, in an ideal world, everybody is on the same page and everybody's involved in those discussions, but it is a very case-by-case situation. I think knowing the family well and being there right at the beginning really helps because you've developed that rapport over time to be able to navigate those tricky decisions with them.
When I first spoke to you, you said our job is to help people get through treatment as unscathed as possible. What did you mean? How do we get scathed, if there's such a word?
I don't think it's possible to go through cancer treatment without some scars. It's a traumatic experience. Any life-threatening illness is traumatic. So there are things in our control as health professionals and things that aren't in our control. So the things we can control are things like appointment times, consolidating appointments, getting them all on the one day if we can, rather than getting them in 3 days in a row for appointments. It sounds like practical, insignificant things, but they really have an impact. So it means potentially that the young person is able to go to their school assembly, is able to go to their graduation with their peers, and they are big milestones. And what we're working towards is, as I said, unscathed as possible, but as well-developed young person as we can by the end of it, despite going through this horrendous ordeal.
Thank you.
My name's Jennifer Chard. I'm a radiation oncologist. I work at the Crown Princess Mary Cancer Centre at Westmead, and I work in the paediatric team and with the Youth Cancer Services team.
And so what sort of patients do you treat, and what sort of treatment do you offer?
So I also have an adult practice, but my main game is treating children and young people aged 0 to 25 years. And my specialty is radiation oncology, so that's treating tumours with X-ray treatment. And I also specialise in brachytherapy, which is another type of radiation treatment where we actually put a radiation source right next to a tumour, and that's really good for some types of cancers.
What's been interesting talking to members of your team is that what you describe is a highly technical medical intervention, and yet there's been a very strong focus on the human relationships between the team members and between the team members and the family and the children. So I want to hear about what you've done to build a culture of care and communication and support. Tell us about that, and what's that got to do with being treated for cancer?
In some ways, it's straightforward to treat someone for cancer and just deliver the treatment, but to do it well and to have people and families who feel well and can go on afterwards, that's a much more difficult thing. And in fact, the whole medical community is only just getting their heads around how to do that and how to do it better.
Why is it hard for a family to feel well while their child's being treated?
I think it's such a traumatic experience to go through, to have a sick child. We don't have a framework to put that in. I mean, sick adults and adults with cancer is something that we're used to in some respects, but sick children and sick young people, that's really hard for people to deal with. From an emotional setting, from a young person who may just be starting off their life in a new job or with a new family, it's just not what they expect, and cancer is completely out of the blue. So the things that we're doing here to try and make that better for patients and families, certainly there's the technical expertise, and I think here we are all technical experts in our field with additional training to be able to deliver the care that we have. But the things that are much harder to measure are the things that we are able to, and the services we're able to wrap around the patients and their families.
Tell us about the services you offer and the sort of different staff you have so that you can try and deal with that emotional challenge of cancer.
I have a luxury here that I have a whole range of staff around me that I can call on to deal with different aspects of patient care. For example, if I need a psychologist that's expert in treating teenagers, I've got one. If I need a social worker for looking after patients and their families and their siblings, I've got one. I've got access to a school support service network. I've got access to a vocational and educational support officer, as well as the nursing care and the radiotherapy care we've got here. So I feel that I've got access to anything that I could possibly need to support a family, including things that we might not even have thought of that the family brings to us that they'd actually like help with. I think we're really good at problem solving on the run and dealing with situations that are outside the normal medical setting that we might get taught about, say, at medical school.
What I'm hearing from you is that if we're going to really offer a better experience in psychological or emotional terms to children and their parents around cancer, you've got to have a multidisciplinary team, and you've got to have enough staff, and you've got to have enough time.
Exactly. So having enough time is really important in establishing rapport with patients and their families in order to get them through treatment, as well as having enough time for each one of those members of the team to get to know the patient and their family, to be able to help them in the best way.
We've met a family and a young boy who's just turned 4, who's still currently in treatment. He's had radiation without needing a general anaesthetic. From a purely physical health point of view, why is it important to try and, if we can, reduce the use of general anaesthesia as a means of keeping a child still during radiation therapy?
Well, general anaesthetic every day is something that we do frequently if we need to, and of course if we've got very young children we have to. It's the only way to get them through treatment. But if you can avoid it, it means you avoid fasting overnight and having grumpy children in the morning, and you can be flexible with the time you have treatment. You don't have to do it that first thing in the day. And of course, whilst we know that it's safe, there are some factors that we'd like to avoid general anaesthetics if we at all possibly could. So if we can avoid them, we can, and then often patients and parents themselves manage a lot better if they don't have to deal with the extra stress of a general anaesthetic every day.
What can you do to nurture the well-being of the team? Because the harsh reality of cancer is that not every child will be well.
That's true, and that's a reality that staff working in paediatric oncology and young adult oncology do have to deal with. I am very fortunate that we have a team setting here where we all support each other and can acknowledge that we will each have tough days for whatever reason. It's unusual that we all have a tough day at the same time, but that we have a space where we can be open and talk to each other and discuss some of the really difficult things that we see on a day-to-day basis.
Is there anything else you'd offer to other cancer team members watching this that you've learned about supporting each other so that you can attract and retain really good team members?
I think creating a culture where everyone feels that their opinion is valued and that can come with a new idea, even if it's not a good one, even if it doesn't pan out. So it's a safe space to be your best self and to do your best work and to take risks and make the most of the opportunities that we have. Not everywhere is like that. I think sometimes we're on edge in our departments, but in my team, I feel like I can bring an idea and discuss it with everyone and truly have it talked through. And ultimately, I think that benefits our patients because we can be more creative. We can offer treatments in radiotherapy that we couldn't do otherwise because I've got a team that's willing to push the boundaries, discuss new ideas and create new things.
Well, look, I just want to say thank you so much for welcoming us into your treatment area, into your hospital in the middle of a pandemic when all this is going on. It's just really been fantastic to talk to you and your team members. Thank you.
Thank you.
And welcome if you've joined us while we were at Westmead, west of Sydney. It's wonderful that you've joined us this evening. And it's great people are making comments in chat. We'd love to see more comments in chat. We've had comments saying how important it is to have lots of staff, as was discussed, the gratitude for the recognition of trauma and the impact it can have on patients, including young patients, for a considerable period of time, and also gratitude for the focus on the family, and a big tick to Jennifer Chard for the way she's answering the questions. But look, it's welcome back now to our co-presenter tonight, the chairperson from Cancer Voices South Australia, Vicky Bedford, who's also a mother of a young person who's received treatment. A couple of things you found valuable there, Vicky, you think, let's highlight that.
I really loved what the father said about emotional intelligence and how that helps to remove that invisible barrier between the clinicians and the team and the family that's supporting the patient. But also the pre-visits, that was a really big thing for our family, helping the child to not see that treatment space as such a traumatic place every single time. I know Shona in the comments, she mentioned the trauma, medical trauma is a real thing, and it's really tough to deal with on these children. So helping them overcome that's a great thing. And then Tora, with the central point of contact, the only way we can make a true shared decision making is if we understand as patients, and this is a brand new world for us. It's a new language, a new landscape. So having someone help us navigate that is a really big deal for a lot of families who aren't familiar with medical terms.
I must say, I was incredibly impressed by the focus of the entire team on the emotional well-being of the child and the family. In your experience with Cancer Voices, is that common?
We see it in certain places, but it tends to be in real pocketed areas. Dr. Chard, I believe, she just really seems to have a really good culture of the team, and it really starts from the top and filters down really, and that whole team really wants to help each other. And made a great point there in the end about, you're not always going to have a good outcome. So you need to have that support around those patients and the clinicians who they do become like our family. And when you lose somebody so close to you, it's very, very tough to deal with. So I think the more support we can provide for everyone around there is great.
Look, thanks, Vicky, and I look forward to your comments after our next journey. We're about to travel to look at another service and to see how they're seeking to improve the patient experience, the family experience to do with radiation. We're travelling now to Melbourne. Well, let's start with the so-called children's videos. This is all about how to improve the radiation experience for patients and families. Tell us about the videos you make. What's their purpose? How are the young people involved? And how do you think it improves the experience for them, but also for their family?
Sure, thanks, Julie. So, most simply, I guess there's a few aims of the project, but if we think about it, it's, just to have a bit of fun on the day, first and foremost, to break away from, I guess, the general day of treatment. And I think it gives children anywhere from, they could be a superhero, they could be a princess, they could be a music star, or it could even be a basic documentary. But it provides an avenue for them to express themselves in a way sometimes they can't, especially with the younger patients. They have a lot of fun with it. Sometimes they take on the persona, say, of a superhero, and it could even help them with the treatment quite substantially. So we have quite a broad range of, I guess, videos we make, and
And you talk about fun. Is this work you're doing with these marvellous videos more than distraction? Do you see it as more than that when we speak in terms of improving the patient experience?
Yeah, absolutely. Look, I think it's different for every child and family. So, for some children, it's a way to remove the stigmatism associated with cancer treatment. So they can, show that to their friends and family, and sometimes, show it in a fun and interactive way. And it kind of breaks away that barrier, which is, really great. It also provides families, generally to show them what's happening, and sometimes a lasting memory, of a time of, of that treatment. So I think it certainly has a lot of benefits, besides, having some fun, running around sometimes and creating some fun videos. So, and provides an avenue for a lot of kids to tell their stories, a lot of the oldest children as well. So,
Radiation therapy can be quite a daunting experience, not just for children, but anyone who's undergoing it, as you're well aware. So we were very mindful of that and wanted to try and provide an experience that was going to make it a little bit easier for our children or our paediatric patients to get through. There was an idea that we put together with some colleagues up at the Murdoch Children's Research Institute and developed a research protocol on the back of a virtual reality experience that we developed, which takes the child through, not only the child but also their families and their friends as well. It takes them through the radiotherapy experience prior to it actually occurring. So for those of you unaware, radiotherapy is a two-part process. It's the radiotherapy simulation, which quite often involves a mask getting made, which for anyone can be quite a daunting experience. And then there's the radiotherapy, which is a series of treatments over anywhere up to sort of 7 weeks of radiation. So the virtual reality experience is filmed through the eyes of a child. So the child puts the goggles on, they can actually watch the child go through the radiation therapy. We've also filmed it so that it can be visualised as if the child is actually having the treatment themselves or having the mask made themselves, so that when they actually go ahead and have the procedure done, it is hoped that they'll have a better understanding of what's going to happen, in the hope that then it would then lead to reduced anxiety and improved health literacy about what's going to happen, so that they're a little bit more at ease going into their treatment.
Is part of the purpose to reduce the need for sedation?
Yeah, definitely. That was one of the things we were looking at doing. Obviously, younger children find it more anxiety provoking, I guess, this procedure. So that was very much part of the initial, brief for this project, to try and reduce that need. And it is something that we've been looking at as part of our research project as well, to try and negate the need for general anaesthesia as part of their treatment.
Look, let's turn now to the work you've been doing in relation to PEG tubes. And just for the uninitiated, could you explain what they are and what was the purpose of your research, and again, lessons to improve the experience for the patient and their family?
Sure. So a PEG tube is a tube that's put in to the patient to help them get through and manage their nutrition throughout their radiotherapy. And in particular for head and neck cancer patients, where the side effects of the radiation can be quite debilitating and can really impact your ability to maintain your usual nutritional intake. So a PEG tube enables you to supplement that through enteral needs, or straight directly into the stomach without the need to swallow, without the need to eat as we usually would and we're so used to doing, because it can become quite challenging during the course of radiation as those side effects continue to build. But obviously it's a very invasive procedure, having that PEG tube put in. So we wanted to do, the basis of my PhD was trying to predict which patients are going to need them to justify having the PEG tube inserted. So that we weren't giving it to everyone unnecessarily, but also making sure we were giving it to the most suitable patients throughout to manage them best through their treatment. So we looked at a whole series of variables in the patients and also the type of treatment we were giving them, to try and tease out which were the key predictors to enable them to justify giving them a PEG tube. So not only was it helping us in our decision making, but also enabled us to better educate the patients and making that consent process a lot more transparent in that decision making. So it was like what we called it was a risk stratification model. So if you were to, this is your treatment, this is what we're going to be doing, the risk of you requiring a PEG tube for an extended period of time is X%. So we recommend you should get one, and at least enables the patient then, if they choose not to, they know that the onus is maybe more on them to be able to maintain their nutritional intake. So they've got a better idea before signing up, I guess, as to maybe what to expect.
And what are the 3 or 4 key risk factors that predict that a person may well need to put a PEG into their stomach and have food dripped through it right from the beginning of their radiation?
So for sure. So we did a lot of work looking at a lot of clinical predictive factors, so things that we know before they actually start their radiation therapy. And the 2 things that we found out that were really critical in predicting a extensive use of a PEG tube, not only during their radiation but also beyond their treatment, was the size of the tumour. So we call that the T stage. So we found that tumours that had a T stage of T3 or T4, so the larger tumours, those patients were more likely to require a PEG tube for a long period of time. And also patients that have at a certain level of disease in their neck nodes as well, which sometimes where the disease can spread to and requires high doses of radiation. So we found that the level 2 neck nodes were also pertinent. So we looked at different combinations of those 2 factors and found that patients that had both of those were going to feed or need a feeding tube for the longest. Those who had either or of those or one of those, they were likely to still feed for a significant amount of time, justifying the need for a PEG tube. And we found that those patients who had neither of those facets were actually best. They wouldn't require a PEG tube for as long enough to justify having one inserted. So,
one lesson I'm hearing is that your work enables patients to be better informed and therefore involved in a commitment to the PEG as being necessary. Just before I leave the PEG, what about the family? You know, that reminder that radiation is an outpatient treatment predominantly, and families can be very involved in maintaining the PEG tube site, in getting the liquid food down the tube, in cleaning the tube. You know, there's a lot of that care is happening at home, isn't it? So what have you learnt for the family?
Oh, definitely. I think I can speak from my own personal experience. My father actually, not due to a cancer diagnosis, but actually uses a peg tube and has for a number of years now. So I really understand the burden of what maintaining a peg tube is in terms of, as you said, infection control, maintaining the regularity of the peg feeding so that the actual nutritional uptake is maintained throughout the course of a day. So I've seen firsthand and been involved in it myself on a regular basis to know that the family plays a critical role. So I think it's really important to also educate not just the patient but also the family in particular, as they'll play a significant role. And that could be just one immediate family member, it could be multiple family members. So I think the more we educate not only the patient but also the families, the more likely the patient's going to get through their treatment experience with a far greater success and I think a far greater compliance to what we're asking them to do for their own best interest, obviously.
And as you walk into the bunker, the big room where you have your radiation treatment, is it decorated in any way or are there any objects there that are particularly designed to help the children?
Yeah, definitely. We have a dedicated bunker here at MacCallum which is dedicated to our paediatric patients. So it does have some decorations on the wall. We also have a treasure chest in the corner which children can take sort of little gifts each time they finish their treatment as well. Again, to try and make it as, I guess, welcoming as possible, to make them feel, safe coming into our environment and knowing that it's tailored to them. So I think we're fortunate. Our building's only, nearly 4 years old now, I think. So we had that specifically made for that purpose. And also our waiting area as well also has a paediatric specific waiting room also. It has some children's toys, it has a TV set up. It's separate obviously to the adult waiting room as well, which I think serves a dual purpose. It's good for the children because it's a dedicated space for them, but we found a lot of our adult patients were also finding it quite challenging to see children in this environment also. So it also separates them also. So it's got toys, it's got little couches, games, it's where the music therapy occurs. Again, it's where siblings can also be whilst their brother or sister is off having treatment. So it's a really welcoming space for the whole family.
Well, Nigel Anderson, fantastic to talk to you.
Thanks, Julie. Pleasure.
If you wait a second.
Now what's happening here? The leaves are falling.
So the idea came during lockdown and I wanted to make the bunker and the treatment room a bit more interactive. I wanted it to be a bit more friendly and I guess less daunting and for children particularly coming in. So we thought, why not bring the outside in? Bianca from Centre for Projection Arts said, look, we might be able to do something here. Told him the idea of, or the goal of what we wanted to create, guests going around the bunker, make it interactive, and we started from there. And the actual process to get all this done has been, has been 6 months in that sense. So a lot of hours have gone into, creating this first animation. So the feedback so far has been really good. Especially with our paediatric patients, I think it's been really great to see them interact with the art directly, trying to, chase the birds or catch the snowflakes. So, and just seeing, smiles on their face and making, that treatment room or that bunker space, less fearful, less daunting for them has been, fantastic, and that's what it's all about.
Thank you so much to the people at MacCallum Cancer Centre in Melbourne for their extraordinary approach to innovation with a deep compassion for the patient and the family. Joining us again now, Vicky Bedford from Cancer Voices SA, a mother of a child treated. I value very much the highlighting of the role of the family with outpatient care. I think your child had IV nutrition and also central lines. Can you just explain that and any comments you have on the role of the family and how the teams can help?
She didn't have a PEG, so she ended up just having IV nutrition due to some of the complications we had from radiation that caused her not to be able to eat. And it is definitely one of those considerations that we had to work with the radiation team to help her through that. And I really loved, like, again, in the video, the videos that they made for the children, giving them something else to look forward to when they go to these centers to be treated, rather than just another medical procedure, that continuous trauma. And also sharing those videos with their friends and maintaining those relationships outside of this medical field that their whole world revolves around. So that way, whenever one day they hopefully will be off treatment, they can reconnect with their friends and they have that shared experience in a way that's more comforting to them than just all the bad stuff.
Yes, it's funny, our marvellous family at Westmead, the father there talked about emotional intelligence, and I feel like Nigel and Daniel and the people they're working with at MacCallum, they've got this amazing emotional intelligence. There's a lot of, you see their work and you just go, yes.
Exactly. I mean,
it's quite amazing.
The thoughts about their sibling space, having spaces for the siblings to be even, they're really being very holistic in their approach.
Exactly. And look, I just want to say we have a question from a gentleman in India. I'm sorry we don't have clinical people with us tonight able to answer your question directly, but thank you to the people who are making comments, and we will endeavour to communicate back to you in useful ways. And just a reminder that all the interviews tonight, and indeed the whole webinar, will be on YouTube from 9 p.m. If you just Google SAHMRI, South Australian Health and Medical Research Institute, but if you just put SAHMRI into Google, it will come up. Your assistance to promote this brilliant work that's been done here, particularly by Daniel Taylor from Inside IT, I would be most grateful for. But anyway, our third destination is Adelaide. Well, it's welcome now to Dr. Ben Saxon from Adelaide Women and Children's Hospital. Welcome, and thank you so much for joining this discussion about children, adolescents and young adults. Can you introduce yourself and just give us a sense of the scope of the work that you do with children with cancer?
I'm the medical unit head of Paediatric Haematology and Oncology in Adelaide, and we provide chemotherapy, referrals to radiation, referral for bone marrow transplant, all of those things that children with cancers and blood disorders can be faced with. We have a pretty full service. We have on-site pharmacists which help us with our chemotherapy, play therapists, hypnotherapists, all of the really important people for helping a child get through their treatment.
Well, this whole session is about what can we do to improve the radiation experience for children and their families. But of course, many of us who have radiation, I've had it myself, I also had chemotherapy. So what are you doing to improve the chemotherapy experience, particularly for younger children?
Yeah, so younger children, especially if they have to have radiation with it, they might have radiation in the morning under a general anaesthetic and then come over to our clinic to have chemotherapy in the afternoon. And this is a really big day for these children. So we try to keep the operation as smooth as possible. The child always goes first. The anaesthetist always goes with them. We make sure that if a child's old enough, they can adopt other ways of keeping calm during radiation instead of just with an anaesthetic. And then as soon as they come over to us, we make sure that we move quickly to give them their chemotherapy so they don't have to waste more and more time in medical facilities.
Perhaps you could explain what chemotherapy involves and how you keep children still if they need to be still for an extended period of time.
So usually, particularly with the younger children, we get one of our surgical colleagues to insert a thing called an infuser port or a portacath, which is a disc under the skin about here, and it's connected with a fine tube under the skin all the way into one of the veins at the base of the neck. And then that's all under the skin so the child can play sport, go in the water, have a bath, like do anything with that port in. And then on the day of chemotherapy, we put some cream on to numb it, and then we put a needle directly into the port to administer the treatment.
So they don't have the experience of pain and the skin being pierced?
No, they might feel a bit of pushing. So, in fact, the most nervous children actually get more worried about being held in position so a nurse can safely put a needle in it. And that's where, particularly with kids over about the age of 5, we get one of our anaesthetic colleagues or one of our experienced pain nurses to help with some self-hypnosis techniques so that the child can relax into another place while we do these procedures.
Is there anything else you'd like to highlight that you're doing at the Women and Children's Hospital with children being treated for cancer that's about improving their experience? We have seen examples of play therapy, not so much music at this stage, but what sort of things do you do?
Yeah, we have a music therapist who is just loved by everybody, as you could imagine. And she tailors programs to different children at different age groups. And even during COVID, she was making her sessions available on recorded Zoom for the children. And it's not just playing music, but it's getting the child involved in the music, and it's another way of taking them to another place.
Before I let you go, Ben, the first 2 webinars in this series on improving the radiation experience for patients and families, the first 2 were about proton therapy, which is of course coming to Adelaide first in Australia. I think first patients expected to be treated in around 2024. And the Australian Bragg Centre for Proton Therapy and Research is, I think, at the moment a building site very near to where you're sitting now, near the Royal Adelaide, and you're part of the consultations happening there. In a nutshell, in the work you're doing as someone who works with children all the time, cancer patients, 2 or 3 things you're hoping the Bragg will achieve to improve the radiation experience and to have that kind of linked and seamless connection to the Women and Children's Hospital in Adelaide as well?
Well, firstly, it'll be closer because around about the same time we'll get a new Women's and Children's Hospital just a little bit along North Terrace. So that'll be a huge bonus. The layout of the reception and clinic area is really child-friendly. We've had a lot of input into that. Myself and some nurses and play therapists and music therapists, and it's looking really promising. And then in the bunker, there's separate areas for young children with activity areas and a little hideaway place for teenagers because they like hideaway places, basically. And the plans look phenomenal for all of these things. So I'm really looking forward to having a non-frightening experience for something that is pretty much intrinsically frightening.
Yes, well said. Well, Ben Saxon, it's just a delight to speak to you, and thank you for joining us for this session that's focusing so much on children, adolescents and young adults. It's really great to meet you. Thank you.
Thank you.
Well, ladies and gentlemen, we're going to keep you just under 10 minutes if you're able to stay with us, because the focus tonight is both on the young patients but also on the family, and we're going to travel now to Albury, Wodonga, just near the Victorian New South Wales border, to see a wellness centre that offers a refuge to the whole family. Let's travel to the Albury Wodonga Regional Cancer Centre and meet Ben in the Wellness Centre. G'day, Ben. Introduce yourself and tell us where you are.
Hi Julie, yeah, good to talk to you. So we are at the Wellness Centre at the Albury Wodonga Regional Cancer Centre. So in terms of the people who come to the Wellness Centre, so what we offer is a supportive, welcoming space for patients and their families to come and still be within the broader cancer centre, but I guess step out of that more clinical space and into a space that feels more relaxing and welcoming. And so one of the great things that we do is offer a range of different things. So we have different services on offer. So they include a clinical psychologist and a social worker that people can see at no cost. The fantastic Bravehearts on the Murray group have a wig library. So for women who've lost their hair through treatment, they can come and get a wig, and it is one of the most amazing things to see somebody coming in who's maybe feeling a bit uncertain of themselves, feeling a bit self-conscious, to get fitted properly with a wig that really suits them, and they just leave really feeling on a high. We link in with different oncology massage providers, so that's quite a big thing that we do. And one of the things that I've really looked to drive in the Wellness Centre since I've been here is to expand it beyond the walls of this building. So rather than just having a provider in Albury, we've now got providers in Deniliquin, Echuca and Wangaratta, so we can get a real spread of services out to where people are living.
Can you describe physically the Wellness Centre, where it's situated and what's available in it when you come there?
Yeah, so and I guess with those services, we also offer a range of different programs. So we run mindfulness programs, different cancer council programs. We've got exercise and yoga starting up. We also have a number of support groups who meet here as well. So that's quite an integral part of what we do, is provide this place where people can come and meet who have a shared experience, where they can get information and support and be with people who have a similar shared experience, which tends to be quite a supportive environment. So it's those sorts of people who are coming in and accessing our services. And we also make sure that any programs or support groups that we run, they're in person as well as online. Again, it's this part of this wanting to sort of push out into these broader areas that we live within to try and include as many people as we can in what we do here.
And is there an outdoor area as part of the centre?
There is. So we have a fantastic garden outside, and so it's a great space where people can come and sit in the winter sun. I mean, there's beautiful trees and bushes out there, lovely table to sit, and we also have access to a barbecue as well. So we had a recent men's support group meeting, and we decided to mix things up a bit and invite the guys to come along to a barbecue. So something a bit more informal where they could still connect with each other but also enjoy a meal that was provided by some local businesses.
For people who have to travel a considerable distance to their treatment, I've been a patient myself, and there were times when I would spend all day at my cancer centre by the time I had some radiation in the morning and chemo in the afternoon. How are you able to support those people who've really got to travel and their family?
Because the big thing is it's not just people in Albury Wodonga. It's like sometimes people are travelling up to 2 hours each way to get in here. Because we've got this comfortable, welcome, inviting space, we have tea, coffee, light snacks and things like that. So people can come in here and wait between appointments. They can have a cup of tea, they bring their lunch. So in some ways it's like a bit of a lounge room away from home where they can just come and relax, talk to people and have some quiet time if they need it as well. So they don't feel like they've got to go off down the street. They can stay on site and still get access to great services.
Thanks so much, Ben. I really wanted to highlight the quality of the Wellness Centre and what you're doing there in Albury Wodonga, way out of the capital cities. So more power to your arm, and thanks for joining us.
Thank you. It's a pleasure, Julie.
Well, it was fantastic to go to Albury Wodonga and see what they're doing there. Look, just before I give you a quick preview of our final webinar next week, where we're going to look at closing the gap for First Nations people, I just want to give a big thank you to Anne's Chog and also to Cancer Voices South Australia and Vicky, the chairperson. Vicky, a final comment from you, something significant from tonight you'd like to highlight?
I think the biggest thing for me was the team effort. We saw in all the different centres that the team effort between the patient, the family, and the clinicians is key to making sure this works well for everybody involved.
Exactly. A multidisciplinary team, and then as high a volume as possible for your particular cancer. I think, all the evidence says that gives us the best chance. Look, next week we're going to look at closing the gap, and we've got unique interviews with people in rural and remote Australia, many Aboriginal clinicians speaking as well. And our partner for our webinar next week is Cancer Australia, and my co-presenter will be Professor Jacinta Elston, who's the chair of Cancer Australia's leadership group on Aboriginal and Torres Strait Islander cancer control. I'll miss you, Vicky, but I look forward to welcoming Jacinta. And here's a quick preview.
My name is Annie Taylor. I live in Baroola, Northern Territory, in the Gulf of Carpentaria. And in that community, we have 4 clan groups, language groups. So there's Yanyuwa, Garwa, Mara, and Gurangi. My language is Yanyuwa and Garwa, and the 2 that's most spoken in Baroola.
Can you talk to us about what you do when it's discovered someone in your community's got cancer, and what you do to try to help them get well?
Because Baroola is such a long way from Darwin to their treatments, our clients are scared to travel. They don't like travel long distance. So my job is to try and break that barrier for being scared and being away from family and being away from community, country. Yeah, it's a different environment for them to go for their treatment.
How is it different? What's Borroloola like compared to Darwin?
Borroloola is like, it's isolated, so there's somewhat bushland, and they, whereas in Darwin, you got big tall buildings and hospitals and doctors and nurses, and medicines. Yeah, different sorts of machineries they got there. Yeah, and they're scared of that.
Can I ask you, how do you help people not be scared?
By talking in language and supporting them, encouraging them, because they know me and I speak language too, and they trust me. Their trust is very important.